All right, thank you all very much for joining us for our press briefing with regard to the state's response to the pandemic. As always, we remind people, we're still in a pandemic. So even though we've got lots of good news, hospitalizations are down, cases are down, we got vaccines on the way, we still need people to please continue to use the tools we've given you to be able to slow the spread of the virus. That means, keeping that 6 foot of distance between you and other people when you're out in public, wear a mask when you go to the store, wash your hands often for 20 seconds at a time. And one of the really important rules is if you've got that fever, that cough, that you've lost your sense of taste and smell, please stay home. Those are big indicators that you may have coronavirus, and we don't want you spreading it out there. And especially as we hear about some of these new variants that are more transmissible, we really want people that if you've got those signs, please stay home. You can go to Test Nebraska. We've delivered over 689,000 test results through Test Nebraska. We have turned those results around every day this year, except for one, in 24 hours or less. And the average time is like 14 hours. So we're getting those test results out of Test Nebraska turned around very quickly. TestNebraska.com. Please take advantage of it. But remember, again, we've got some of these variants. And again, we don't have our 3 C's sign up, but avoid the 3 C's. We want to finish strong here as we get the vaccines out. So please continue to help us slow the spread of the virus. Of course, all the things we're doing are to be able to make sure that we provide that hospital bed, that ICU bed, or that ventilator to anybody who needs it when they need it. So please continue to follow those rules. And right now, we're looking really good. We've got 31% of our hospital beds are available, 34% of our ICU beds are available, and 79% of our ventilators are available. And we've also been able to continue to administer the vaccines. We've gotten 397,000 vaccines out, and so that's all good news. Also, one of the things we've been working on is the data reporting. So you may have noticed, if you've been tracking it, the New York Times, that we have moved up on the ranking in several of those categories. Right now, we're ranked number 21 as far as first dose out to about 15% of the people. We're 23rd with regard to second dose. Let's see, is that right? No, maybe it's in that same category. We've got a little over 7%, and then we've got about 75% of our doses administered, and that puts us about number 26, which is an improvement from where we were before. Again, still middle of the pack. We want to move up more. We're taking steps to be able to do that, but we have seen improvements over the course of this last week with regard to those rankings. And again, I was able to visit Lincoln Lancaster and what they're doing at Pinnacle Bank Arena. Very smooth process. We had a very smooth process last weekend at Creighton in Douglas County, so we're getting vaccines in people's arms. All right, well, speaking of vaccines in people's arms, one of the things that workplaces can do is encourage people to get the vaccines. And this is a benefit to those organizations that are encouraging it, right? Because, of course, we know, especially if you're in a small business, if you have a number of people who get sick all at once, that can be disruptive to your operations. And we've certainly seen that around the state. But even for larger organizations where you're not likely to encounter that, if you have folks getting vaccinated, obviously that's going to help keep them healthy. It's going to make all the coworkers feel better about coming into the workplace. So encouraging vaccinations is an important thing to do for all of our businesses. To be able to talk about that here today, we've got the CEO of North End Teleservices, Carmen Tapio. Now, North End Teleservices does business with the state. They've been helping us out, for example, with our Department of Health and Human Services. They work with the Department of Economic Development. And Carmen's company has been named to Inc. 5000's fastest growing companies in 2020. So it's a rapidly growing business. Carmen's growing her business and doing a fantastic job. She's number 677. She tells me she's going to continue to move up that as well. She's going to continue to improve upon that. So we're very pleased to have Carmen here talk about vaccinations. So Carmen, please come up and share with us a few words.
Thank you, Governor. Good morning. My name is Carmen Tapio, and I am founder, CEO, and president of North End Teleservices, a company based in North Omaha. We are a for-profit enterprise. I began working in the teleservices industry when I was 18 years old, making a career of it that took me around the world, serving in global leadership roles. I also founded and operated a successful consulting business, and I've also been a chief diversity officer for a global company. North End Teleservices is a contact center providing services to both commercial and government entities, and we have grown to be the largest African-American business in the state of Nebraska. We employ over 400 people, and I'm also very proud, as the governor said, to work with various departments, including the Nebraska Department of Health and Human Services as one of our clients. Through our partnership with DHHS, we have helped in the vital role of contact tracing to help isolate cases and keep clusters from spreading. We appreciate the opportunity to serve and to do our part in helping to slow the spread of COVID-19 in the state of Nebraska. I have a passion for community and also for business, and it is our mission to help create jobs and change lives while continuing to make an increasing economic impact in our state. And this is one of the reasons why I was very happy to hear about Governor Ricketts' actions to open up a North Omaha office, field office for economic development. In addition, the Department of Administrative Services and State Procurement Office has also expanded its ongoing efforts through the recently launched Procurement Contract Concierge Program, which expands its outreach to minority communities and businesses and teaches them how to do business with the state of Nebraska and support their efforts in doing so. I am impressed with the leadership. I and my business have already experienced the benefits from both the DED and the concierge program, and we are grateful for those efforts. All of these efforts continue to help connect residents of North Omaha to more opportunities to create jobs and grow businesses. North Omaha has quality workers, exceptional leaders, and this support will expand opportunities in our community. In regard to the vaccine, a lot of great things are happening in our community, and we're anxious to get back to normal. In the vein of strengthening Nebraska's economy, I want to remind all citizens that one important way that they can contribute is to get the vaccine when it's available to you in an effort to end COVID-19. I know many small businesses and small business owners have been significantly impacted because of the pandemic and the challenges it brought to our state. The Nebraska Department of Economic Development has helped to lessen that impact through some of the grants that were made available to businesses last year. I also understand that there are some misgivings and distrust when it comes to the vaccine, but I would urge you to do your research and to educate yourself about the facts. The state's Finish Strong campaign has been designed to provide access to credible information so that you may be fully informed and comfortable with getting the vaccine. And I've been out to the website, and it's a really tremendous site. There's some great information available. And to access the site, go to finishstrong.ne.gov. The vaccine is critical because it can save lives and help us get back to the business of business in our state. So thank you, and thank you, Governor Ricketts. Appreciate the opportunity. Thank you.
Great. Thank you very much, Carmen, and thank you for being a great partner for the state. We appreciate all your work, especially on this contact tracing, helping us respond to the pandemic. That is a big deal. So thank you very much. All right. So that was Carmen Tapio, CEO of North End Teleservices. Let's see. So a couple things. One of the things that we know also is that Johnson & Johnson today, Dr. Anton, correct, is going to be having their public hearing with regard to the FDA. Is that right? As we're speaking right now, they're doing it. So we have seen some of the information out there from Johnson & Johnson. It's very good news. Again, very effective when we're talking about preventing disease, but especially effective in making sure that you don't go to the hospital or have those severe reactions that could lead to death. So very excited to have another vaccine from Johnson & Johnson. We're being told that if Johnson & Johnson gets the emergency use authorization from the FDA, which seems likely here because the data all looks very good, that they'll be able to deliver a couple million doses across the country here as early as next week. And then by the end of March, they expect to have 20 million doses out, and then by the end of June, 100 million doses out. So that will add on to the other doses that we have available from both Moderna and Pfizer. And remember, Moderna is supposed to deliver 100 million by the end of March, and Pfizer 120 million by the end of March. So you can see that we've got about 240 million by the end of March that will be available. I think we're sitting at about 80 million, maybe a little bit more right now, vaccines that have been delivered. So there's more vaccine coming. So that's very, very exciting news. We're pleased about that. Second bit of news is the stimulus package that the House is working on right now. And I just want to comment on this because this is something they're talking about that is going to be detrimental to Nebraska if they continue down the path they're going, which is to focus those dollars based on unemployment rate. So each of the states took a different response on how to respond to this pandemic. Here in Nebraska, we tried to balance slowing the spread of the virus with allowing people to live a more normal life. And so we've had the lowest unemployment rate in the country for the last 5 months in a row. If the federal government would distribute stimulus based upon unemployment rate, they're penalizing Nebraska and other states like Iowa and Kansas who have done a good job of trying to balance this off, and they're going to be rewarding states like New York and California that have very different outcomes, shall we say. So they're basically going to be penalizing people who have done the right thing. That's not the way you want to approach any sort of government program. The per capita way is the fair way to do it, and that's what Congress should do, is look at, if they're going to do a stimulus package, do it on a per capita way. That way, everybody gets treated equally. It's an equitable way to do the stimulus package. And remember, Nebraskans pay federal income tax just like New Yorkers do. We shouldn't be disadvantaged by their policies. So anyway, I just wanted to encourage folks to reach out to their congressman or their senator to talk about that, because that's, again, Iowa, Nebraska, Kansas, we're the ones that are going to be disadvantaged by what Congress is proposing. All right, so upcoming schedule, news conference 10 a.m. on Monday and Wednesday, and then I'll have my call-in show that's at Central Time, 10 a.m. Central Time, Monday and Wednesday here, and then 2 p.m. next Monday, Central Time, will be my radio call-in show for the month of March. All right, so we've got a number of questions. Jack Williams, NET, on Tuesday, Douglas County Health Director Audie Poor said that there were 850 unfilled appointments for COVID-19 vaccinations in Douglas County. Does it concern you at all that local health districts are basically having to wait for people 65 years and older to fill appointments when they could be moving on to other categories of people who are more willing to be vaccinated? Is that a flaw in the system? Would you consider altering it to speed it up? Jack, I think you're misunderstanding what Dr. Poor is saying. She's saying she has opened up appointments. She's only got 850 left now through the middle of March. So appointments are filling up quickly. So if you want to get an appointment, please get registered and get signed up. I think you're misinterpreting how Dr. Poor is saying that, because it's the amount of appointments we have are quickly being taken up. And I'll just use the example of Saturday. Again, we delivered 4,798 vaccines in one day at that mass vaccination clinic we had at Creighton University. And I want to thank all the staff and students who volunteered to help make that happen. But yeah, we only have 850 left. It's not that they're not being filled, it's they're being filled very quickly. Patrick Jansen, News Channel Nebraska. There has been some information shared about how vaccine responds to new coronavirus variants, but what is being done to prove the effectiveness of testing for the new variants? Has the testing been tested for these new mutations? Probably a question for Dr. Antone, so I'll let him come up here in a second. UNMC is, follow on, Patrick asked, UNMC has discovered new variants in Nebraska that are not the UK or South African variants. What is being done specifically to track those variants and others in the state? And will the state data monitor different outbreaks or lump them together? And then is the state working with Lincoln in preparation for the Nebraska State basketball tournaments? If so, what work is being done to ensure the events over the next couple of weeks? So I'll address a couple of these things. So with regard to new variants, for example, Johnson & Johnson was tested in a global environment, and in places like Brazil and South Africa was still very effective. So actually the vaccines are being, even now, are being tested on those new variants. I will have Dr. Antone come up and give us a little bit more detail about that. With regard to the state, you may have read in the Omaha World Herald that the Nebraska Public Health Lab has a new machine to do the gene sequencing. You have to actually sequence the DNA to actually know if it's one of these new strains generally, not universally, but generally. So for the past several weeks, the state has been taking samples to sequence, to search for the new variants. So we are monitoring to see if we have the new variants here in the state. And we're also leveraging other sequencers in the state as well. So we're continuing to monitor it. But again, the indication so far is that the vaccines are still effective against all these different variants. And I'll let Dr. Antone talk about that more. And then finally, is the state working with Lincoln in preparation of, for the state tournament? So the state establishes the directed health measures, which requires organizations to work with your local health department on a plan for having these types of events. So the basketball tournament will have to work with Lincoln Lancaster to put the plan in place, how they're going to socially distance and all that sort of good stuff. But that's how that will be taken care of. And so with that, Dr. Anton, you want to come up and talk a little bit about the variants and vaccines?
So we've all known about these variants. The first variant that was really sort of made the news was back in December, where the United Kingdom had a variant called the B.1.1.7 variant, and that's the one that became the predominant strain over in the UK, and now has been over in the United States. At the last CDC update, the UK variant is now present in 45 states and territories of our country, with about 1,881 cases. It's taking off a little bit slower maybe than what we thought it might, which is great, which is why we want everybody to still follow the 3 C's and the non-pharmaceutical interventions. And so far, the vaccines that we have, the Moderna, the Pfizer, and now the Johnson & Johnson vaccine seem to be very effective against the B.1.1.7 variant. As the governor mentioned, there's also a South African variant and a Brazil variant, so far not really that prevalent here in the United States. And then as the governor mentioned too, Dr. Gold down at UNMC is saying maybe Nebraska might have its own variant. And that's what they're finding, like every state's gonna have their own variant sooner or later because the virus mutates and we're all gonna have a local variant probably. But as long as we continue to do what we're doing as far as the non-pharmaceutical interventions and getting vaccine into people's arms, we should be fine. The thing about the sequencing, and so far we have a great team leader. Our lab team leader is Dr. Matthew Donahue, and he's been working with Dr. Pete Iwan at the Nebraska Public Health Lab so that every positive specimen that is tested at the Public Health Lab is now being sequenced for these variants up to 130 a week. And so far, the Public Health Lab hasn't had 130 positive specimens per week for the last several weeks. So we put out a Health Alert Network advisory notice this week to tell providers that if they see something that they think might not be quite right, such as maybe a reinfection, a patient that had a COVID infection in the past that now they think has another infection, or a patient that might be fully vaccinated past 14 days or even less and now has a reinfection. Those are the ones we want to get sequenced to see if they are the variants, to see if that's why they got a reinfection or why they got infected after receiving the vaccine. So that's the importance in doing those sequencing. Dr. Donahue is also working with other labs in the state and specifically in the Omaha area where they also have these sequencing machines. So hopefully we'll be able to sequence maybe every positive specimen or at least every specimen that we know might be suspicious for being a variant specimen. So I'll end it there. And basically what they do is they sequence the RNA, that RNA of that virus. So that's all I have.
Thank you, Dr. Anton. You're right. I said sequence the DNA. They're sequencing the RNA. Caught me on that one. Okay, I got it. All right, so Scott Miller, KNEB. I guess the question would be what's being heard from the Biden administration on whether the application will even go forward. If it does not, what would be the upshot for Heritage Health? And is there still an effort to provide expanded benefits or would everything be basic coverage? So this is basically the letter that the Biden administration sent us with regard to our Heritage Health program. This is the Medicaid expansion. And this is a great program. It encourages wellness. We're really pleased with what we put together here. And while the Biden administration has not given us the go-ahead to go forward on this, we are going to be communicating with the Biden administration about why this is really a good thing for Nebraskans and how it's going to help people encourage that wellness and why really it's going to be a benefit for the federal government as well. So we're looking forward to having those robust conversations with the Biden administration. And then Julie Anderson, Omaha World Herald. We're hearing that you will require local health departments to switch their vaccine registration or at least appointment making and record keeping to the state's vaccination website as of April 1st. Is that correct? Is there another date? Will this be established through DHM? If so, why require this change late in the game? It's actually not late. When the health departments already have developed workable solutions, has the state's system been fully tested? And then how much will the state system cost, and why did it come online so late, which is not late? So first of all, Julie, I say a couple things. One, many states don't have a system yet, so this is something, the federal government actually had their own system they were putting out there, which we chose not to adopt, and that's been a good thing because my understanding is the federal system has been very unstable. So if you look around some of these other states that maybe went with that, they may be reconsidering that decision right now. It's also something that we had to work with our vendor as Microsoft. So we had to work with Microsoft to develop this system that will be an inventory management system as well as a scheduling system. And this is so we can provide really a one-stop shop for customers all across the state, right? So we can really provide a great customer service. Think about it. If you got your first dose in Lincoln, but you wanted to go get your second dose in Scottsbluff, you'd want to be able to do that, right? Maybe either because you moved or you were traveling or whatever reason, you'd want to be able to do that. So we have to have a statewide system so we can provide that level of customer service to be able to allow somebody to be able to do that. And we want to be able to do that. We also have to do it from an inventory tracking standpoint to make sure that we're utilizing the vaccines as quickly as possible and getting them in people's arms as quickly as possible. With regard to some of the other states or other health department systems, for example, on Saturday, we did 4,798 vaccines. I talked about the Creighton Clinic that went so well, but that was all done by paper. Douglas County was on paper for that clinic. So we want an automated system so that people can register online, that it can be all tracked electronically and put into that. And we want to get away from that paper. We want to have, for example, QR codes so that we can easily track that and make it such that we minimize the data entry, which is, been going on, for example, in Lincoln and Lancaster County and Douglas County. So we want to get away from that. So we're putting a system, and we're going to collaboratively work with our health departments to be able to get them onto that. But we do need everybody on that. And so we're going to ask all the pharmacies to get on that as well, right? So that we can make sure we're sharing data with them and getting that data in. We need to have a system that is going to get kind of that global view of what's going on in Nebraska. And that's why we're rolling this out. And so we obviously had to create that tool. And that's what we're working with on Microsoft. But also, think about it, folks, we're going to be doing this probably the rest of the year. We're going to be doing vaccines. So yes, there's a big push right now to be able to get as many people vaccinated as quickly as possible. But we also anticipate that we're going to be having vaccines come into the state throughout the course of the year, certainly through the middle of summer, and that some people will choose different times to get vaccinated. And we want to make sure that we're able to accommodate all those folks. So this is something you have to think longer term than just like the next month or the last 2 months. This is something we're going to be doing for a while. And again, why we need to have a tool that everybody's on so that we can make sure that we're providing a high level of customer service and, getting vaccines to people's arms and being able to do a good job with that. So anyway, so we're going to be working to get that rolled out as quickly as possible with the different local health departments once we've got that tool up and running. Okay, and how much does the state system cost, Dr. Antone? I don't recall right off the top of my head. Julie, we can follow up with you with regard to the cost of that. I don't know if I've got that off the top of my head, but you don't happen to know rough? We'll follow up with you with regard to how much that state system cost. And obviously that was paid for with CARES Act money. All right. Matt Olberding from the Lincoln Journal-Star. Once the J&J vaccine is approved and Nebraska is getting shots, will it be prioritized for 65-plus crowd, even though it has a slightly lower effectiveness? And again, I would say that while you're looking at the effectiveness of getting the symptoms of the disease, it's very effective in keeping you out of the hospital, and 100% effective is my understanding on preventing you from dying. So again, one of the reasons we're prioritizing the 65 years or older crowd is that we want to get to people who are most at risk. Remember, 83% of our deaths in Nebraska have been from folks who are 65 years and older. 94% are from people who are 55 years and older. So we want to prioritize that group, so we're going to use the Johnson & Johnson to continue to work through Phase 1B, and again, prioritizing those folks who are 65 years and older.
Governor, I just found out that the Johnson & Johnson vaccine is just as effective, maybe even more effective in the elderly population.
And Dr. Antone is saying that the Johnson & Johnson vaccine is just as effective, if not more effective, in the 65 and year older crowd, or in the older, for our seniors. So again, something that's going to be good, and encourage you folks, as soon as your turn comes up, get the vaccine, please get the vaccine. Matt also asks, I've been told that the state has taken over control of scheduling for shots for the retail pharmacy plan. Is that true? Also, have more locations in Nebraska been added to the program in the last couple of weeks? So with regard to the federal retail pharmacy program, remember, this is the program the federal government is running. They have not coordinated with the states on this. Maybe I'll talk about that just in a minute. But with regard to, I don't believe there's been additional pharmacies added, though there may be pharmacies that were originally part of it that are now receiving vaccine. And with regard to the state, we, again, don't have our overall software program implemented yet, but we will be working with those pharmacies to make sure we're interfacing with them. And what, in the meantime, we're doing is asking local health departments to work with those pharmacies on the scheduling. So, for example, some health departments are providing lists to those pharmacies of who they should call up and get vaccinated, again, following our guidelines around 65 years and older, you know, again, just getting the data back from them so that we can, again, know that we can provide a great customer service. And remember that some people will sign up in multiple different locations. So they may sign up for their local pharmacy, they might sign up for their local health department, and we want to make sure that we're getting to everybody and who wants that vaccine and do it in the most customer-friendly way. So we will be working with those pharmacies to get them on that same system for the state, so we have that global view of what's going on in the state, and it's for the same sorts of reasons, right? Say you get your vaccine in Omaha, you want to be able to go to Scottsbluff and get the second dose. We have to be able to have a system that allows us to manage that. So we will be doing that once we get that system up and running. And then also, I just want to highlight a little bit also about the pharmacy program, because I'm going to have a conversation with the White House about this. The goal, one of the goals for the federal pharmacy program is to target folks who are homeless, in public housing, limited English, and also migrant workers. But they didn't really do it in consultation with us. And so, for example, some of the locations are in long-term care facilities that aren't public-facing. So that doesn't really help you accomplish your goals if you had those four categories. One of the locations was in a wealthy part of Omaha, for example, that's not near those locations and so forth. So what we want to do is work with the federal program and the White House to be able to help guide them to accomplish the goals. We think the goals are great goals to accomplish. We think they can better and be more successful at this if they work with the states to help target which pharmacies are actually going to be more in line with the types of pharmacies or the populations they want to serve through this. So that's what you know, I'll be having a conversation with the White House about, is see if we can get a little bit more closer cooperation for that. All right, so I know Carmen has to leave here in about 5 minutes at the latest. So if anybody's got any questions for Carmen, this would be a good time to ask questions for Carmen. If not, we'll just open up. Andrew, you get was that your hand going up? Yeah. Carmen, you want to come up here real quick, and Andrew will ask you some questions before you have to leave?
Some of the things that we're doing to encourage our employees to get the shot is we're making all of the information that's available through the state of Nebraska available to them as well. And we have, since the start of the pandemic, really been intentional about having a consistent communication plan around ways to stop the spread, but also as new information, public health information is coming available, pointing them to those resources. And so we are posting this information to our employees and talking to them about where they can find credible information.
And how do you feel about some businesses either offering a carrot or a stick, you know, either requiring people to get the shot or actually, you know, giving them money to get the shot?
I think that businesses should take whatever steps they feel are right for their business. So in terms of offering sticks or incentives, different environments, different employee bases are going to need different types of encouragement. And an incentive, if that's what a business decides to do and they see that it works for them, then by all means.
All right, any other questions for Carmen? All right,
All right.
thank you very much, Carmen, appreciate it.
Thank you.
Thank you again, Carmen. And I know you've got to leave, so thanks very much for making the time to be here this morning. We appreciate it. All right, other questions? All right, so Taylor's got several questions texted in.
Chris from NTD, I think you might have totally correct information here. He asked, why were people with disabilities moved off of phase 1B, specifically those without Medicaid are no longer able to get the vaccine? Does the governor have plans to put them back into phase 1?
So I'm sorry, so Chris with NTV is asking about people, disabilities being moved off of phase 1B, so, and not being able to get access through it through Medicaid? So I'm not sure where you're getting that information from because, well, first of all, this vaccine is free to everybody. So there are some providers who are charging an administrative fee to your insurance if you have insurance, but if you don't have insurance, that's not a problem, you won't be charged. So you don't have to worry about it from that standpoint. And Medicaid, of course, is covering this too out of pocket. So I'm not sure where that information is coming from because, again, this shot is free for everybody. And then with regard to phase 1B, we've got all those, actually, I think a lot of those folks would have been taken care of in our congregate settings that we've got if they haven't been taken care of already. So we haven't changed any of the status with regard to folks who are disabled with regard to any of these rankings. So none of that's changed. So I'm not quite sure what that's about. Dr. Anton, do you have any thought?
I was thinking maybe
You want to come up here?
comorbidities,
Do you mean comorbidities? If it means comorbidities, again, we've talked about that age being is the single biggest factor with regard to the fatalities we've had in our state, and that's why we've been prioritizing folks who are 65 years and older. So maybe you can text it back in and get a little bit more clarification.
Brent from Channel 8 asks, as more companies produce vaccines, will Nebraskans get a choice of which one they get, and how would that be decided?
So Brent from Channel 8 is saying that, or is asking if there's more vaccines being produced, will Nebraskans get their choice with regard to which vaccine? I would say that we will have more information with regard to that down the road, but for the time being, I'd encourage all Nebraskans, when your term becomes available, please take the vaccine that is available to you at that time. Obviously, you'll all have the opportunity that if you want to wait, you can certainly wait. Not everybody's going to want to get the vaccine at the same time, but we certainly encourage you as the vaccines are available, please take the vaccine that's available to you when your turn comes up.
And then Brent also asked, if age is the #1 consideration for getting the vaccine, why not direct health departments to dedicate 100% of their doses to that group instead of the current 90%?
So Brent's asking if age is such a big consideration, why direct health departments to do 90%, why not direct them to do 100%? And again, the rationale there is really to be able to give health departments some flexibility with regard to that, doing that vaccine. Understanding, so for example, if you look at healthcare workers, keeping our healthcare workers is important to keeping other people healthy, right? If you look at our first responders, we talked about this for first responders, utility workers, staff at homeless shelters, and so forth. Those folks are public safety issues. So we had some public safety issue concerns around that. So again, we wanted to be able to have some flexibility with regard to our health departments on doing the vaccines while making sure the vast majority of our vaccines were targeted at those folks 65 years and older.
Natalie from KMTV says, according to a study from the United Kingdom, adults with Down syndrome are 10 times at greater risk of dying from coronavirus than the general public. Is the prioritization of these adults being reconsidered, or will there be special vaccination clinics set up for adults with severe underlying health conditions?
So Natalie's saying that folks with Down syndrome are 10 times more likely than the general population. Is that right? Natalie from KMTV, is that what she said, 10 times more likely? And so obviously they're greater at risk than just the general population. And as I said, when it comes to some of those other underlying conditions, we'll have more information on that going down, coming down the road. But again, if you, again, look at our data here in Nebraska with regard to age being the single biggest factor for the folks, that's the one that is why we're driving the 65 years and older. And for other folks, we will be looking at data with regard to and having more information about how we're going to address that.
And Julie Anderson from the World Herald has a couple questions. She wants to know if we have any word on workplace vaccination clinics.
Do we have any word on workplace vaccination clinics? So some local health directors, for example, have been working with specific businesses that would be in the categories we talked about, so like healthcare. So to the extent that they are related to things like law enforcement or healthcare, you could see some workplace things from that standpoint. But right now we're focused on phase 1B, which is primarily folks who are going to be 65 years and older. So that's where the focus right now is, and that really doesn't fit into a workplace. It's going to be more like what you see in Omaha and Lincoln, where you have clinics like at Creighton we had on Saturday, or the Pinnacle Bank Arena here in Lincoln. I will note that when I was at the Pinnacle Bank Arena, one of the things that Lincoln Lancaster had been doing is some of their law enforcement officers were coming in for their second shot. So they were managing to catch some of the folks who would be more employment-based in that mass vaccination clinic, along with the folks who were 65 years and older.
And then finally, she asked, do you know how many doses have come into the state so far from the federal pharmacy program?
Do I know how many doses have come into the state specifically for the federal pharmacy program? Again, from Julie Anderson. I don't know that number off the top of my head. Dr. Antone, you don't happen to know that off the top of your head, do you?
84,680 total for federal and long-term care, and I think about 55,000 or so, 60,000 came in for the long-term care. So subtract the 84 from 60, so I think it's been 5,700 doses a week for the last 2 or 3 weeks.
So Dr. Antone thinks it's been 5,700 doses a week for the last 2 weeks. Maybe a little bit higher than that, but we can follow up, Julie, and get you the exact numbers. All right. Andrew. Dr. Antone, you got a question. Remember, please repeat it.
Doctor, yesterday on your, was it Facebook Live, is that what you had? Did you say that people with comorbidities, people and under, were going to be moved to phase 2?
Yes, yeah, it'll be phase 2, 2A, for people that are less than age 65 with comorbidities. And as the governor's been saying, you know, we're working on that plan right now about how to work that in. So stay tuned on that. But we are going to take into consideration patients with comorbidities.
Do you know when that might, start occurring?
You know, I can't give you the exact timeline, but I'll estimate within the next 2 weeks.
So that's.
Okay, let's be clear about what you're talking about, Dr.
Yeah,
Antone.
we should have a plan in place for how to deal with patients under age 65 with comorbidities within the next 2 weeks. The plan, not that we'll start on vaccinations yet.
And what are you kind of considering with those comorbidities? Are you like ranking them, or there's more than one? How do you?
I think in our discussions, and we discuss this all the time amongst our team, is that the main ones are people that are immunosuppressed. So the main comorbidities would be patients that might have cancer that are on chemotherapy or on medications for immunosuppression, such as transplant patients. Then another group would be patients that are on dialysis, so chronic renal failure patients. And then the third group would be, patients that might have pulmonary issues, that would have difficulty if they did need to go on a ventilator, getting off a ventilator. So those are the top 3 that we're considering right now. Obviously, there's a lot more in that, but those are the ones we'd probably focus on at first.
Why are you thinking 2 weeks? Is that because, is that when your program or your computer, your online registration will be up and running better, or is that what you're waiting on, or is it something else?
Yeah, Andrew asked why will the plan take a couple weeks? Because we need to set the logistics in motion on how we'll get to those groups of patients, on how that will be prioritized and how they'll be notified and where they'll go to get vaccinated.
And I'm sorry, when do you think they might be able to get their vaccine?
I don't know when they'll be able to get their vaccination, because we want to get the 1B done first, the age 65 and older. And, whenever that's done, then that's when they'll probably be able to get their vaccinations.
And I have another question, maybe you can answer this. I mean, it seems like the hospitalizations are going down, infections are going down. Is that due to the amount of vaccinations that, you've already been able to do? Or is that because maybe we've had more exposure to this virus than maybe we even expected?
So Andrew asked, why are hospitalizations going down? Is it a combination of maybe, patients being vaccinated? We started to see our hospitalizations go down even before the vaccine came out. So it probably had something to do with just what the whole Midwest saw during this time in mid and late December, where hospitalizations started going down. Right now, we have tested almost 50% of the Nebraska population. Of those 50% that have been tested, our population, we have about 11% of our population testing positive. We show up here on the screen that we have about 9% of the population has received their second dose. So if you add those numbers up, people that have been infected and people that have been fully vaccinated, we have about 20% of our population now with immunity, which is a good number, and that's only going to go up with time. We also get data from the CDC and from the Red Cross on people that donate blood or give blood for other purposes like a lab work, on what their antibody prevalence is. And we're seeing right around a 20%, 25% seroprevalence in the population of Nebraska. So, and actually the Red Cross shows about a 35% of healthy donors that go in to donate blood that never thought they had an infection having antibodies for COVID. Now, that's not a scientific study, but it sort of gives you an idea about what the seroprevalence is here in our state. So we're getting there. Most people think we need about 60 or 70% immunity, maybe a little higher, 75%, in order to reach that herd immunity threshold, but we're slowly getting there.
All right, other questions? Andrew? Well, Andrew, when you show up, you get to ask the questions, so it's fair.
Yeah. Governor, do you have concerns about banning conversion therapy?
Excuse me, do I have concerns about banning conversion therapy? Again, I presume there's a bill that you're talking about that is in there?
Lincoln just passed an ordinance banning conversion therapy.
Oh, Lincoln passed an ordinance banning conversion therapy.
Coming up.
Well, I think, again, when you're talking about conversion therapy, you have to talk about, it's like one of those broad categories. I'm very concerned when we start restricting the ability of healthcare providers to provide the type of treatment that they think is important. I think in general, though, you have to look at specifically what are you talking about. So are there things that maybe not be appropriate? Well, there may be things not appropriate, but I don't know the details of what Lincoln did, so I can't speak to what Lincoln did, or I haven't looked at any of the bills that we've got here.
Are these healthcare treatments or are they religious treatments?
Well, again, I'm also concerned if you're going to be trying to infringe upon religious freedoms as well. Yeah.
Nebraska Family for Medical Cannabis had a presser on Wednesday, hoping to push for legislation to get medical marijuana passed. They cited Nebraska as one of a few states that don't allow for it. Are you concerned, or do you feel that it's just a matter of if rather than when medical marijuana would be allowed in Nebraska?
So the question was, do I think it's a matter of time is it if or when marijuana will be legalized here in Nebraska? And I think that if we educate Nebraskans about the dangers of marijuana, that I don't think the legislation will get passed this year. Certainly I'm going to oppose it. But if it were to be put on the ballot, I think Nebraskans would vote it down. I think once people know that you are risking people's lives by legalizing marijuana on a number of different fronts. You're risking people's lives when you legalize marijuana. If you have it in the workplace, data shows that you've got more workplace accidents. We see that you put people's lives when children get a hold of, say, edible marijuana. We've seen this in Colorado. We see the psychotic or psychiatric effects of this. Levi Pongi, 19-year-old in Colorado, ate a marijuana cookie and jumped off a ledge, killed him. So, and that's not, and he's not alone. There are other people that have that psychotic reaction that ends up leading to their death. So marijuana is actually killing people. We see it killing people on the highways. We see when states that legalize marijuana, their highway traffic deaths go up due to marijuana. So I think when you educate Nebraskans about the dangers here, and also remind them that big marijuana is owned by tobacco. These are big corporations that are trying to not be regulated. That's what this is about. Don't be fooled by what is being put out there by these big corporations who don't want to be regulated. This is an industry that does not want to be regulated. We have a way for drugs to be used in a way that is safe, legal, effective, and that's called go through the FDA. And as Dr. Antone pointed out previously, I think in one of your Facebook Live events, that you look at how quickly these vaccines have been approved, right, going through the FDA process, how quickly they were developed and approved. The FDA can move quickly if it's necessary, and that's the process everything should go through. Every drug, if you want to take something like marijuana and turn it into a drug that is going to be medically beneficial, it has to go through the FDA process.
It's time for a final question.
One more question, Andrew.
Can the governor, there seems to be some concern as to whether state regulators moved quick enough in the meat ethanol plant situation. Do you believe that they did all they could in a proper timing?
So the question is with regard about to the timing of regulators moving on the ethanol plant in Meade. And again, as a state, we have a followed process. We have, laws that we have to go in place. So the state moved as quickly as the process would allow to be able to address the issues with regard to the Meade ethanol plant. And we are continuing to work with, the EPA, and the plant and so forth on getting them into compliance. Obviously, they issued the letters about shutting them down. So we are taking steps, and it was done in an appropriate way and an appropriate time frame based upon, the laws and the way that we manage the process.
That's all the time we have.
All right, folks, thank you all very much. Again, a reminder, 10 a.m. on Monday, back here in this room, 2 p.m. on Monday Central Time, will be the radio call-in show. Thanks very much, and everybody have a great weekend. Please remember to continue to keep that 6 foot of distance, wear a mask, wash your hands, stay home if you've got that fever, that cough, or lost sense of taste or smell, and avoid the 3 C's. Sign up for vaccine. Oh, you can also sign up vaccinate.ne.gov. If you have difficulty with the computer side of it, you can also call into the 833-998-2275 number and get help that way. Thanks a lot, folks. Have a great weekend.